Then follow up with another shower, this time using a mild soap. Then rest for 15 to 20 minutes. The purpose of the shower after the body has been oiled and the LD oil or flax oil has penetrated the skin is that warm water opens up the pores so the oil can penetrate a bit deeper into the skin. The second shower with soap is for skin surface cleaning, so the clothes and linen will not become soiled too much. I know I've been told by many people that they have put the flax oil on in areas of pain, such as on their hands, their wrists, their arms, shoulder, and left the oil on with no shower, and has worked well for pain relief for many. But if they can, they may want to follow Dr. Budwig's recommendation. People will have to figure it out for themselves.
Mike, it appears she was trying to get as much of the electron-rich oil into the body as possible by putting it in internally and externally. She was also trying to fire the entire body.
I absolutely agree with you on that. Dr. Budwig even went further and in her book brought up the relationship between the fat syndrome, electrons, photons, and solar energy provided by the sun. She pointed out that the sun is an inexhaustible source of energy and an element of life that affects the vital functions of the body. Dr. Budwig found when she treated patients and had them lie in the sun, she noticed they started feeling much better and became rejuvenated. She referred to the sun as having a stimulating effect on the secretions of the liver, gallbladder, pancreas, bladder, and salivary glands. Dr. Budwig mentioned that doctors tell patients and cancer patients to avoid the sun as they can't tolerate it, and that is correct. She says once these patients start on her oil protein nutritional advice for 2 or 3 days, which means they have been getting sufficient amounts of essential fats, they can then tolerate the sun very well. She said that patients then tell her how much better they feel as their vitality and vigor is re-stimulated. The last of the points mentioned by Dr. Budwig, and maybe the most important, is that the electrons in our food serve as the resonance system for the sun's energy and are truly the element of life. She said, man acts as an antenna for the sun. The interplay between the photons in the sunbeams and the electrons in the seed oils and our live food governs all the vital functions of the body.
Well, you know, God created our bodies. I mean, just look at what we eat each day and how far off track we've gotten. When I think of what I used to eat and drink, no wonder we're all coming down with these chronic and terminal diseases.
I definitely agree with you on that. We're all guilty of this, and some are better able to handle it than others. Some of us definitely have a stronger genetic makeup.
Well, you've done an excellent job in explaining the science behind this protocol and Dr. Budwig's research. Can you explain how you combine the ingredients of the flax oil and the cottage cheese together in the protocol, and what are the options?
Yes, I can. When making the flax oil and cottage cheese recipe, try to use only flax oil from the refrigerated section of your health food store, if that's available. I talk with people worldwide, and in some countries, it's not. So people will have to use what they can get. But once opening the bottle of flax oil, I refrigerate it. 2 very good brands of flax oil here in the United States are the Barleans and Spectrum brands. I would use the cold-pressed organic flax oil. If you live outside the U.S., you'll have to see what's available or search the internet in their respective country. I have heard that Barleans may have a program for cancer patients where they can buy the flax oil directly from them with some discount. Anyone could call them to see if there is a discount for cancer patients. It never hurts. The phone number in the U.S. is 1-800-445-3529. I would check the expiration date on the flax oil bottle prior to purchasing in the stores to make sure that it's not expired. I would not use the high ligand flax oil because the taste is not clean and you cannot tell if it's rancid. If you accidentally purchased it, I would go ahead and use it as long as the expiration date is good, and then get the other next time. The reason I don't use the high ligand flax oil is that they've left the husk from the processing of the seeds in the bottom of the bottle, leaving less product. Plus, I don't like the taste or the brown color. In reading Dr. Budwig's books, I don't ever recall her using flax oil with ligand. You'll want good, clean tasting, golden in color flax oil and no flavoring added, as some oils are doing. The mixing ratio, for example, could be 4 tablespoons of 1 or 2% low-fat organic cottage cheese were available to 2 tablespoons of flax oil. This is a 2-to-1 mixture, meaning 2 parts cottage cheese to 1 part flax oil. Mix only the amount you're consuming at one time, so it's mixed fresh each and every time, and then immediately consume it. In some countries, people cannot get the organic cottage cheese, so they will have to use what's available. But try to use the lower fat content where possible, as it must have some fat content to the oil to break it down. One example of what I'm talking about would be a mixture: 4 tablespoons cottage cheese, 2 tablespoons of the flax oil, consumed twice a day. Say once in the morning and once very early in the afternoon, say around 1:30 p.m. Never eat this in the evening, or it can keep a person awake and can cause a very bad case of insomnia. A person should start slowly with the flax oil and cottage cheese, maybe just once a day, first thing in the morning, and work their way up, letting the body adjust to the protocol. The flax oil and cottage cheese must be thoroughly mixed at a low speed, and it's recommended using the immersion or a stick or wand-like mixer for this. If you're not familiar with this type of blender, just internet search for it to see an example. You would blend together the ratio I mentioned. For example, blending until a creamy texture was achieved with no oil floating in the mixture. Many times you might have to thin the mixture out by adding some milk to the cottage cheese and flax oil mixture, as it may be too thick, clumping together when blended or after adding ground up flaxseed, which thickens it up dramatically. I use 2% low-fat organic milk, blending a little of the milk, cottage cheese, and flax oil together at a low speed until nice and creamy, and again, no oil floating. You may have to play with the mixture until you get it to the consistency you want. Then I pour this mixture into a cereal bowl. Next, I would suggest grinding up a tablespoon or 2 of freshly ground flaxseed in a small coffee bean grinder and sprinkling over the top of the freshly mixed flax oil and cottage cheese mixture. Then I mix this with a spoon. Do not buy pre-ground flaxseed, as the flaxseed goes rancid 15 minutes after grinding. Brown or golden whole flaxseed is available at the health food stores, and either one will work. This supercharges the protocol. I suggest to store the seeds in the refrigerator and grind fresh each time. Do not pre-grind. The mixture can be flavored differently each day by adding nuts, preferably organic, such as pecans, almonds, walnuts, not peanuts, banana, organic cocoa, organic shredded coconut, fresh pineapple, blueberries, raspberries, organic, especially on raspberries, or don't use them, cinnamon, or freshly squeezed fruit juice. It's usually best to place the fruit on top of the completed mixture and enjoy it as its own meal. I mixed it in by hand, as I like the taste of it better this way. Try your best to obtain organic fruit when possible. Many times this can be found in the frozen section of the stores when not in season. Dr. Budwig pointed out that people who are suffering from a chronic or terminal disease should work themselves up to consuming 4 to 8 tablespoons of the oil daily when using the Budwig protocol.
I would never start out like that, or it would make a person sicker than a dog.
Definitely, and I would never start at these higher limits, or a person could become very ill. I would suggest a person start slowly and work up. Usually the higher limits, 6 to 8 tablespoons, and we should note here, those are U.S. tablespoons, were for people with cancer. But I know of people with other chronic or terminal conditions, such as diabetes, scleroderma, and so on, which I mentioned earlier, that have done very well at the upper limits. I personally am not able to do it at the higher limits, as it nauseates me. I like the 4 to 2 ratio, meaning 4 tablespoons cottage cheese, 2 tablespoons of the oil, and a person can adjust up or down from there. One warning here, though, is that people with lung, liver, pancreatic, and gallbladder type cancers, for example, may have to work up very slowly with the oil and possibly only start with 1 teaspoon at a time, giving their body time to adjust and working up to the 1 tablespoon or more per day. Remember, 3 U.S. teaspoons equals 1 U.S. tablespoon. If you overdo it too fast with the flax oil, you may find yourself on the floor balled up in pain, such as in a pancreatic cancer case from an overload of the oil. I just saw that happen recently. So let me re-emphasize that. Not too much too fast on that oil. Dr. Budwig pointed out that cancer patients, once started in the protocol and getting it under control, must continue with a maintenance dose to prevent reoccurrence. A maintenance dose of the flax oil and cottage cheese is considered 1 U.S. tablespoon of the oil per 100 pounds of body weight to 2 tablespoons of the cottage cheese. It's simply a 2-to-1 ratio. Each person on a maintenance dose needs to stay on this for at least 5 years. The Budwig diet takes time to work, and in the event of cancer, tumors, etc., may take 3 to 6 months to see results. Many other health issues may respond much faster. I suggest a note of caution in regards to the Budwig protocol. Dr. Budwig did not include drugs or supplements in her protocol guidelines. In her 1999 book, she spoke against them. Every person must use some common sense here, though. Some patients wean off of some drugs slowly under a doctor's care while doing the flax oil and cottage cheese, as they can or are able to reduce the pharmaceutical drugs as they go along and the body's healing itself. Remember, it's simply a nutritional protocol. Always consult your doctor in these matters where possible. Flax oil is known to have a little blood thinning effect. So if you're taking a higher amount of the flax oil and cottage cheese, tell your doctor so he can adjust downward any blood thinning drugs, including aspirin. I'll cover more of this in detail further into the series. Some supplements, especially high amounts of man-made antioxidants, can seriously interfere with how well the diet works. Some pharmaceutical drugs and treatments, such as chemo and radiation, cortisones, hormones, and painkillers, can interfere in how well the protocol works. Many times, though, when you start on the protocol, as time goes by, the need for the drugs lessens, and in many cases, a person finds there's no further need for them. Dr. Budwig also warned against the dangers of oxygen therapy for the cancer patients and said that cells are not ready to absorb oxygen, but are healed through diet.